Good day everyone, I am Senior Clerk Venice Nunez and I will be demonstrating how to properly insert a chest tube. Before you start, make sure to introduce yourself and confirm the identity of the patient. Explain what you are about to do, ask for any allergies, secure consent form, prepare the materials prior, do proper hand washing, proper gloving of hands, proper donning of sterile gown and proper draping of the site. Calculate for the proper dosage of the anesthetic to be used. For lidocaine, it is given at 5 mg per kilogram, and for lidocaine with epinephrine, it is given at 7 mg per kilogram. Here is a sample computation for a 50 kg patient. Chest tube insertion is a procedure where a hollow tube is inserted between the ribs into the pleural space to drain either air, blood, chyle, pus, or other fluids. Indications are pneumothorax, hemothorax, pneumohemothorax, empyema, and subcutaneous emphysema of the chest wall in a patient with sustained chest wall trauma requiring ventilator support or general anesthesia. Materials needed: scalpel, forceps, surgical scissors, needle holder, large Kelly clamp, vaselinized gauze, silk O with curved cutting needle, syringe with local anesthesia, povidone iodine antiseptic, glass bottle system with underwater seal, chest tube, sterile gown and drapings. Have the patient assume a semi-upright position with the arm above the head. Prep the skin over a wide area of the chest wall with povidone iodine. Do this in outward concentric circles using the sternum, subcostal area, posterior axillary line, and the clavicles as landmarks. Drape the area with 4 towels. Place the first towel on the side nearest the surgeon. Then place the towels in the cephalad, caudal, and on the lateral side opposite the surgeon. Secure the drapes with towel clips. Starting at the angle of Louis, which corresponds to the second rib, count 2 to 3 ribs down and locate the 4th or 5th intercostal space along the anterior axillary line. At the 4th or 5th intercostal space anterior axillary line, infiltrate the skin with a local anesthetic and block the intercostal nerve branches. Do not forget to infiltrate the pleura. Make a 2.5 to 3 cm long skin incision well into the subcutaneous tissue. Insert a curved Kelly clamp and separate the tissues so as to create a tunnel or tract in the direction in which the tube is to be inserted. This tract should be directed posteriorly, cephalad, and medially so that the tube lies posteriorly in the paravertebral gutter. Continue developing this tract all the way into the pleura. Remove the clamp and explore the tract with a gloved finger from time to time to make sure that the tract is going in the right direction. After the pleural cavity has been entered, insert the gloved finger to explore for adherent lung. Further enlarge the opening in the pleura using a large Kelly clamp and spreading it. If hemothorax is suspected, it is advised to clamp the distal end of the tube to avoid making a mess. Measure the distance that you want the tube to extend into the chest. Then grasp the tip of the tube with a long Kelly clamp so that the long axis of the clamp is parallel to the axis of the tube. Insert the tube into the chest using the large Kelly clamp as a guide. Remove the large Kelly clamp as soon as the tube reaches the desired position in the chest. Palpate superiorly and inferiorly to ensure that the tube has entered the chest. Suture the tube to the skin with silk O. Pass the stitch around the tube to close the wound margins. Tie the suture in place tightly to the skin. Wrap the ends in opposite directions around the tube to form a series of X's. Push the suture down to the skin edge before tying again to prevent slack from being incorporated to the suture. Connect the tube to the underwater sealed chest drainage system. Properly secure the two connecting tubes, as this may cause pneumothorax if the tube is disconnected from the underwater seal. Place a Vaselinized gauze dressing around the tube and push it against the wound margin to prevent air leak. Cover the tube site with a 4x4 gauze. Create a slit at the center of the two gauzes and then place them 90 degrees to each other to prevent the gauze from sliding off the tube. Dispose of contaminated materials into their respective receptacles. Lastly, obtain a post-tube insertion chest X-ray to check the position of the tube. And you're done! I hope you learned a lot from my video, and thank you so much for watching.